Welcome back to the Cullman Regional's Better Health Now podcast. Today I have the opportunity to sit down with Dr. Adam Crisologo, an anesthesiologist here at Cullman Regional. Thank you so much for joining me.
Yeah, thanks for having me.
Yeah, so to kind of get us started, tell us a little bit about your background and why you chose anesthesiology.
Sure. Yeah, well, I'm originally from Cullman, kind of born and bred here. My dad was actually an anesthesiologist here for about 31, 32 years, so I was always surrounded by it when I was younger. Ever since I was little, I always knew I wanted to be a doctor, wanted to help people about that sort of thing, but didn't really know what I wanted to do at the time. As I kind of progressed through medical school and going through rotations, I really fell in love with anesthesiology. It's a really good combination of getting to be active with your hands as well as, going through everything as far as like both. It's a mental and physical specialty, and I really enjoy that. Feel like I get to have instant impact on my patients and help them through a very difficult time in their lives. Not everyone's favorite thing is to go in and have surgery, so it's a special time to go in and really be able to comfort people during that time, provide them reassurance, and get them through these times.
And so how long have you been here at Cullman Regional?
I just started back in August of 2024, so I'm fresh out of training. I spent a lot of time in Kentucky while I was away from Alabama. Did my undergrad, medical school, and residency in Louisville, Kentucky. Then I came back, I did 1 year back in Gainesville, Florida for a additional training year in regional and acute pain anesthesia. Then the opportunity was available to come back and just help provide care to my hometown.
Yeah. So tell us a little bit about the differences between general anesthesia and regional anesthesia and what determines which is used.
Yeah, so general anesthesia really describes the depth of basically how asleep someone is during surgery, meaning that their airway needs to be supported and protected in some form or another via either a laryngeal mask airway, an LMA, or a endotracheal tube, like a breathing tube. So most surgeries do require to undergo general anesthesia just to have the depth of comfort and monitoring and safety. But others can also be done with regional anesthesia, which is basically using nerve blocks or neuraxial anesthesia, which is epidurals or spinals, to help numb the particular location of the body that they're having surgery on, or they can be used in combination. So say someone needs to go to sleep for whatever reason for the surgery, we can also do nerve blocks to help out with pain control both during the surgery and after they wake up to have better pain control without having to use an excess amount of opioids.
Yeah, and so with the targeted pain, like for areas or certain areas of the body that maybe they're having surgery on or whatever it might be, not all of those cases the patient's completely asleep. It just depends on sort of what the surgery entails and if there's other things that need to be involved with it.
Right, and so one of the common areas or specialties of surgery that are often done with nerve blocks are orthopedic surgery. So if someone's coming in having a broken wrist, broken finger, ankle surgery, those all can be done completely under regional anesthesia if the patient prefers. Most often want a combination of sedation with the regional instead of just laying there awake for the procedure, which would be exciting for some. But often we use a combination, and that's especially beneficial in the sicker patient population who may putting them to sleep and putting them on the anesthesia vent, like our breathing machine back there, may not be the safest things for either their heart or their lungs. It's a way we can get around putting people to sleep, but also getting them through surgery safely.
So we talked a little bit about both the general and the regional. There's been a lot of advances in science and medicine that have led to improvements with anesthesia, the effectiveness and the safety. And you talk a little bit about some of those improvements and how those directly affect kind of the work you do on a daily basis.
Yeah, so definitely from the general anesthesia side, the improvements have definitely been a lot of our IV medications that we use, as well as some of the gases that we use that have changed over the last couple decades. They tend to have safer side effect profiles. They tend to be a little bit more gentle on the at-risk organ systems like cardiovascular, pulmonary, that sort of thing, as well as they tend to just have less side effects of people having nausea, vomiting. Let's see, some people used to have agitation or delirium after that tend to, when Demerol was used previously, we don't really use that as much now, but the medications we use on that side tend to have a lot safer side effect profile and have less of a harmful impact. From the regional anesthesia side, nerve blocks have always kind of been there in the last several decades, but the improvements in ultrasound technology has really advanced that area of anesthesia, meaning the better image quality we can get when we're ultrasounding looking for a particular nerve has gotten significantly better. So instead of looking at a snowstorm on a screen type picture, you're able to pick out each individual nerve, blood vessel, muscle.
Wow.
You can really distinguish what you're looking at and make doing the nerve blocks substantially more safe.
Why is it important, as you're working with a patient that maybe gets going under anesthesia, why is it important for you to see your patients before they go into surgery?
Yeah, so that's a common thing, and especially if patients are coming in for a larger surgery like a total knee, total hip, other surgeries that could be longer lasting than your kind of short, quick cases. Anesthesia can take a toll on your heart, lungs, every organ system. So getting those patients in what's called our pre-admission testing clinic, and we often have them come a week or two before their scheduled surgery. That allows us to kind of set eyeballs on the patient, really see what all medical conditions they have. If there are things with their heart that need a closer look at, say they need to be seen by a cardiologist because they've never had one before and they're at risk for a heart attack, or someone who has severe pulmonary disease like heavy smoker or COPD, ensuring that every organ system is as optimized as possible before coming and having surgery, because both the anesthesia and the surgery put significant stress on the patient. So making sure the patient is as healthy and optimized as they can be to ensure their safety for the surgery.
Yeah. So once that patient is going into the operating room, what should that patient expect to happen? The process from, hey, you coming in and saying like getting the anesthesia set up to them then waking up from the surgery and that process all.
So a lot of times we'll even, we try and give them a good heads up on what the OR looks like, what they may see, what they may hear. A lot of times we do give anxiety medication as we're rolling back to the OR. So some people forget even entering the OR. So, and sometimes that weirds people out. They wake up as the last thing I remember, we were talking in here and then I woke up in the recovery room. Sometimes, if a patient's maybe a little sicker, or we just want to make sure they're on monitors before we give any of that medication, we'll say, we'll roll into the room. We'll help you get over to the OR bed, hook you up to our monitors, just so we get everything kind of set and oriented. Then we'll go off to sleep, or whatever form of anesthesia we use, we'll start then, and we'll get started.
Yeah. And so during the surgery, what is your sort of process working with the patient? Is it sort of hooking them up, monitoring it for a set amount of time, and then going on to the next? Or does it just depend on the surgery that you're applying anesthesia to, depending on what role you play?
Yeah, so in my role as a anesthesiologist, I tend to be observing and supervising multiple ORs at the same time while we have a certified nurse anesthetist in each of our rooms. So patients will always have an anesthesia provider with them during the entire duration of their procedure or surgery. I tend to be there for all the kind of high impact moments of the surgery. So getting the patient in the room, getting them over to the bed, going to sleep. If there's any procedures that need to be done, such as like additional IVs, arterial lines, one nerve block we do is called a tap block. That's a common one we do for laparoscopic surgeries. We'll do that. And I'm also available, of course, at any time. At that point, I typically go out and see another patient, or I'm checking on another room while the nurse anesthetist is continuing to monitor and provide the anesthesia to the patient, unless there's incidences where they need a second set of hands, or just need assistance with something.
Yeah. And so once the surgery is over, how quickly does the patient wake up, and what sort of residual effects could they maybe experience?
Right. So I would say 99% of times in the ORs, when we actually wake the patient up, so whatever form of anesthesia we're using, whether it's IV medication, we would shut our drips off so that it would gradually come off. Or if we're using the gases to keep the patient asleep, it would come off in the room. And we always make sure that the patient's breathing well on their own, that they're maintaining their oxygen saturations well before we either remove the endotracheal tube or the LMA. Make sure they're doing at least good at that checkpoint before leaving the room. At that point, we would take them to our PACU, our recovery room for anesthesia. Or if you've had a general anesthetic needing one of those airways, you would stay there a minimum of 30 minutes just to ensure that a bulk of the anesthesia medicine kind of came off them. They were coming to a little bit responsive, making sure that their blood pressure was stable, oxygen was stable, at least in comparison to how they came in. They weren't having any additional requirements, and that their pain was manageable. At that point, they go to like a stage 2, so they go back out to usually the room that they first presented in to make sure there's not any final things they need taken care of before leaving the hospital.
Yeah. And so it seems like every case is a little different as far as maybe what the patient needs, also depending on the role in which you play in helping them get through the surgery that they might be experiencing at that time. What do you think is the most important thing for surgery patients to understand about receiving anesthesia?
So for anesthesia and the type of surgery the patient's having, and every patient, everything is an individual basis, even though sometimes it may seem like a cookie cutter recipe for certain things. So especially when we're seeing patients pre-op or talking to them over the phone about what they need to be doing to get ready for surgery, it's important that they definitely abide by whatever instructions are being given in the pre-admission testing clinic. So there are some medications that we'll tell them to continue. There will be some medications we tell them to stop. And those are important because they can have significant impact on how much the anesthesia may affect their blood pressure, their breathing, their sugar level, their blood glucose level. So making sure that they come in as optimized and followed all the instructions from the anesthesia side as well as the surgery side before even presenting. And what was the rest of your question?
Yeah, so as a lot of times patients that are anesthesia is not something patients, I guess, frequent. It's always on a need basis. So it's I need a hip replacement, I need a knee surgery, whatever it might be. Making sure what are some of the things that you kind of want to make sure that they are aware of, maybe about the process and maybe any misconceptions.
Right. So still kind of looking at the kind of before coming to surgery, or even in the pre-op area before rolling back for surgery, making sure they stopped eating at the right time, making sure they stopped drinking at the right time, because that can either delay their case or even cancel their case for that day. And that frustrates everyone. We don't want to have to cancel something that doesn't need to be canceled, but also all those things are in place to keep them safe. And, they all have a reason for the request that we're asking. The other thing is, even though anesthesia and surgeries are extremely safe nowadays, it's never been safer at this point in history, but things can still happen. There can be infections, there could be bleeding, there can, it can affect their blood pressure, can affect their heart, their lungs, that sort of thing. So just understanding that, all surgery and anesthesia, it does carry a risk, but that of course that we're always doing our best to take good care of them, and that they're in good hands, and they will always have their best interests at heart going forward. And at any point, if a patient has questions about anything, the anesthesia process, surgery process, always feel free to ask what your options are. I feel like a lot of patients, when I give detailed explanations on what their options actually are, whether it's going to sleep, sedation, nerve blocks, they're often very shocked that they have as many options as they do. And sometimes their health kind of dictates what we can and can't offer a certain patient. But knowing that you do have a choice a lot of times coming in for surgery about, what your preference would be in anesthesia as well.
Well, so. I appreciate it. I think, the understanding that we were able to kind of accomplish with talking about the different forms of anesthesia and kind of the process for the patient. I think it's going to be really helpful for those that are listening. We'll be sure to have everything in the episode notes with more information if people have any questions or any follow-up stuff. But I appreciate you being here today.
Yeah, no, thanks for having me. I appreciate it. Thanks.